Hello and welcome to COVID Conversations here on WNCU 90.7 FM, streaming on YouTube, Facebook, and Instagram. I'm your host, Kimberley Cartwright, News and Public Affairs Director at WNCU 90.7 FM. And we're using the Zoom platform to talk about how COVID-19 is affecting our world. Thank you to the African American Task Force Plus of Durham for making this show possible. Our guest on the show today is Trish Howard. She is the lead nurse of Durham County Public Schools, and we'll talk about COVID testing at DPS. Hello and welcome, Trish.
Thank you so much, Kimberly, for having me today.
It is my good pleasure, and I know that you have a very busy schedule, so let's get to it. COVID testing is underway at Durham County Public Schools right now. Who's making that testing available?
So we're partnering with a vendor by the name of Mako, and that is a vendor that's been issued by the state of North Carolina to make it possible.
Okay. How important is testing at school?
Oh my gosh. Testing is another layer of our prevention strategy. So if you look at it, the first layer is for folks to really assess how they're feeling every day. If you're sick, don't come to school, right? Until we can rule out whether or not you have COVID. Now, our testing, our pool testing, is the way that we catch people who might be asymptomatic spreaders of COVID. And so, as you can imagine, this is for the folks who are not necessarily, they would pass all screeners because they're feeling well. They're in the building. And I like to use the analogy of using almost like a rake to rake through your population of people who are currently in the building to see if there anyone amongst that 200, 300, or 700 personnel that's there, students and staff, who could potentially be positive for COVID and just doesn't know it.
Man, you said 300 or my mouth dropped. I did not realize, but I know that there are lots of kids at school, but I didn't realize just how many. So you have to rake through all of those numbers to see who is positive or who is negative. So is this testing, is it voluntary or is it mandatory? And how do you get to who has COVID?
So for students, it's voluntary. And so we really want to push parents right now, and this is why I'm here, is to strongly encourage all our parents in DPS, if you have not already registered, go ahead and do so. And it's a quick, simple application that you could do. You can complete it from our DPS website. On the top, you'll see a tab marked COVID-19. You click that. There's a drop down to testing. You find your child's school and you register 1 through 3. Once you register for that pool testing, that means once a week, your child will be included in that weekly testing, but it also makes your child eligible for a rapid test should your child become sick on campus. So it's a two for one deal.
2 for 1. So I've had the test for COVID and they take a Q-tip and stick it up your nose so far. So is that what kids have to go through, or with rapid testing, is it different?
So you have the nasal pharyngeal testing and you'd have just the nasal. So what we're doing with the students is just the nasal. That means they're doing just swiping at the near in both nostrils, and that's it. It's a quick and easy test. It's not the tickle your brain test.
Well, now that you say that, why didn't they do? Okay, I digress. So what happens if you find that a student tests positive for COVID-19? I know you got a system in place.
Absolutely. So our system has been in place since the start of COVID. We have a COVID contact tracing team in place. So if within that pool testing, we find a positive person, we automatically go into contact tracing. That student or staff would not be allowed to come back to school. And then we are tasked with finding who that person has been in close contact with. And close contact is defined as being within 6 feet for longer than 15 minutes. Once you've found your close contacts, if they're not fully vaccinated, they weren't masked appropriately, or they've not had COVID within the past 3 months, they then go into their 10-day quarantine.
So can you give me any information on maybe numbers of positive cases that you found, or is that confidential?
It's confidential at this point. I haven't gotten permission, but what I will say is that our COVID dashboard is readily available to anyone who would like to see what our numbers look like in Durham Public Schools. You go to the same DPS website, you go to testing and you click dashboard, and we've been monitoring our COVID positive cases since the start of the pandemic.
So another question, how is it working? Is what you're doing effective, and what are you finding out?
So what we're seeing is that some schools are doing better as far as getting their numbers up of registrants, right? And so I remember one of the doctors from the ABC Collaborative had been at one of our board meetings and stated, you really want to get as much as of your population registered as possible for it to be truly effective. So if you're going to rake, it doesn't make sense you're raking just 2% of your population. But if you have 90% of your population tested, you're getting a better snapshot at, it's a more accurate and effective means if you have more people registered.
So tell me what is ABC Collective?
Collaborative.
Collaborative,
ABC
okay.
is a organization that was formed by some Duke researchers at the start of the pandemic, and they pretty much organized this. They organized to kind of help schools return back to school last June. And so they have been critical in providing research and providing the science around the safety of students returning in the building. They have now gotten to the point where they're advising the North Carolina DHHS in safety protocols. And, fortunately, DPS has been on have been with the ABC Collaborative since the start of all this.
So tell me about inside the school building. Is it mandatory for students to wear masks during the school day? And when are they off mask? Is that allowed?
So we have been one of the districts that went with mandatory masking. So yes, we have a mandatory mask policy in place. They are allowed to unmask when they are eating, when they're outdoors more than 6 feet apart from each other.
So I want to talk now about some of the COVID protocols. Maybe, when students come in, what are their responsibilities? What are they expected to do other than wear their mask at assigned times?
Oh my gosh. So if you think about what safety looks like, right? From the very start, we're asking parents to monitor their children before they send them to school. So that's the self-monitoring piece. Before you put your child on the bus, go ahead and assess if the baby's just not feeling well. Just keep them home until you could rule out. Once the child is on the bus, they get in the building, they have to be masked to get on the bus. They also have to be masked to enter the school building. If the kids do not have a mask will be provided. So we have tons of PPE for our students. Getting in the building, if you think about your 3 W's, to the extent possible, we want kids to be spaced out, if possible, when transitioning from classes. And then hand washing. We want to sanitize, we want to, so that's the other mitigating thing. Outside of that, think about when a child gets sick at school. Then that's another protocol that happens with that child now who just was fine coming to school, but then says, I'm not feeling well. That child is then taken to the care room, may have their temperature taken, parent is notified, they have to pick the child up, and then also get a test to rule them out for COVID. But with our new testing, if that child is registered to do the pool testing, that student can now have a rapid test right at school, get a determination within 15 minutes if they have COVID or not, prior to the parent picking up.
And then what happens if you find out that they have COVID? Are they isolated? Do parents have a specific timeline that they have to come pick them up? What happens?
So this is our ask. So we ask that parents, so everyone has a role to play in all this, right? And so parents, we ask to self-monitor before putting them on the bus. We also that correct contact information is in Power School. We also ask that multiple people are listed as contacts, because you may have a parent who's at work and is unable to get off. If you have several backups with these people knowing that they're backups to you if you're unable to come and get your child, that they are available, that will help from the community standpoint, right? So yes, the child should be picked up in a timely manner. The child would be kept home. So even, let's say they were not COVID positive, but they were still having a fever, there was still something like, there's still stuff like strep throat. You would still want that child to be kept out until symptoms have improved. The child is no longer febrile or no longer has a fever for 24 hours before they can return. If the child is positive, then you just click over in your positive case, you start your contact tracing, you work with your health department, that child now isolates for 10 days, and then the symptoms have to improve before they can return.
So that not only are you dealing with COVID-19, you're dealing with tummy aches and strep throat and possible flu. So how are you managing, and how do you categorize like how to treat every student's malady?
It's simple, but it's not. So if you think about it, right, all the things that kids complained about before COVID are still there. And I think one of the frustration for some parents is, I know this is not COVID. This is my child's sinus. This is my child's anxiety that's causing the tummy ache. Unfortunately, though, in this time, we cannot, out of an abundance of caution, we have to assess all these symptoms, rule them out for COVID. And the quickest way is to get that rapid test. Once we figure out if it's COVID or not, then the child just has to have symptom improvement to return to school. So our goal is to keep children in school as much as possible while you're navigating the strep throat and all the other stuff that still exists.
So as lead nurse for Durham County Public Schools, you said everybody has a role. So then tell me what your role is with all the schools that are in the district.
Oh my gosh. So I'm all things health and wellness, right? So managing schools that have of our nursing shortages, keeping up with kids with medical conditions such as diabetes. Like there's the nursing aspect to all this that existed before COVID, right? Just making sure that kids with chronic illnesses are well managed and are safe in our building. And then you add the layer of COVID. And so working with our health department nurses, our DPS nurses, all things health and wellness, I would say is my role.
So are there different protocols for COVID for different schools? Is it different for the little tiny kids as opposed to like high school or middle schoolers?
No, so the protocols are set. It's for any school, and we wanted to make sure that our protocols are streamlined, that they're consistent, and they should be adhered to no matter which building you're in. There should be no confusion on what DPS's requirements are for the health and safety of our students and our kids. Now, we will say that before this week, only the adolescents were able to be vaccinated, or the 12 and over, right? So we're to get them vaccinated. And if they were vaccinated, 2 weeks post their second dose, if they were a close contact, they didn't have to quarantine. So that was the only difference, is that, you had that age group that may not have to quarantine if they were fully vaccinated. Now that our younger kids are going to be vaccinated, which I'm going to use this as a plug. We have 2 vaccination events this Saturday, one at Hillside and one at Riverside from 10 to 3. Targeting our 5 to 11-year-olds. I'm encouraging all parents, please consider having your student vaccinated in this age group. And if you yourself have not been vaccinated, this is an opportunity for you to do so.
So how are students adjusting to school life during COVID, having to go through all of the protocols, plus make sure that they have their schoolwork done? How's it working out?
Kids are resilient, Kimberly. Kids are resilient. And as a DPS parent myself, I have a 5th grader in DPS and I have an 11th grader in DPS, and they thoroughly enjoy being in school. There's nothing like in-person learning. And so that's what I've seen, is our kids are so appreciative to have that socialization back and to be back in the building where they could communicate with their teachers and eat with their friends, given they're 6 feet apart. but nothing substitutes that. And the children appreciates that. And they do very well with following the masking protocol and just doing what they need to do.
And one last question, then, how are parents reacting to all of this? Are they very readily stepping up to get their kids tested in school? Or are they, just saying it's another thing in the mosh of things that I have to do for my kids?
I would say my parents are along a spectrum, right? So I think for the most part, most parents are in full support of the health and safety of our student, and whatever is asked of them to make that happen, they're willing to do so. Parents who may need a little bit more information or education. And so in my conversation, I may provide that. And you'd be amazed how much just a bit of information works with changing the minds, or, maybe a frustration that a parent felt. Just having that compassionate conversation with that parent to say, I understand your frustration, but here is why. Here's the why behind why we're doing this. And for the most part, I've not met a parent outright, nope, I don't agree. Most parents will come around and they're like, you know what, thank you, Nurse Howard, I understand now. And they will do what's being asked.
Well, we have come to the end of the show. And my guest today is Trish Howard, lead nurse of Durham County Public Schools. Thank you for your time today.
Thank you for having me, Kimberly.
You're certainly welcome. And thank you, audience, for watching via YouTube, Facebook, and Instagram, as well as listening to WNCU 90.7 FM. Be sure to like us. We want you to follow us and subscribe to our pages to see more of our archived shows. I'm Kimberly Pierce Cartwright, your host for COVID Conversations.